What did they use for contraception in the old days? Ever since humans realized how babies were made, they have either tried to conceive children or avoid them altogether. In earlier days, some techniques were more successful than others. An ancient Greek gynecologist told women not wishing to have a child to jump backward 7 times after intercourse. Ancient Roman women tried to avoid pregnancy by tying a pouch containing a cat's liver to their left foot or by spitting into the mouth of a frog. What can women do? Barrier methods of contraception have included pebbles. Arabs prevented camels' impregnation this way, half a lemon, and dried elephant or crocodile dung. In 1550 BC, a suggested concoction of ground dates, acacia tree bark, and honey applied locally was probably fairly effective, since acacia ferments into lactic acid, which disrupts a normal pH balance. In eastern Canada, one Aboriginal group believed in the efficacy of women drinking a tea brewed with beaver testicles. As early as the 7th century BC, a member of the fennel family called silphium was discovered to be an extremely effective morning-after pill. But since it only grew in a small area on the Libyan mountainside facing the Mediterranean and attempts to cultivate it elsewhere failed, silphium was extinct by the 2nd century. Getting the men involved. Men have almost always used some sort of sheath, dating back to at least 1000 BC. The ancient Romans and the 17th century British employed animal intestine, still available, albeit packaged, while the Egyptians and Italians preferred fabric, sometimes soaked in a spermicidal solution. Vulcanized rubber appeared around 1844. The main responsibility for contraception still lies with women, many of whom alter their body's hormonal balance with the pill, introduced in 1960. Meanwhile, due to lack of male interest, research into male contraceptive injections, pills' primary resource, and or nasal sprays has stalled, and the sheath remains men's primary resource.